question is, do you believe that the high quality service that you're providing is meeting the needs of the patients and carers who use it 7 days a week?
It's amazing how often over the last few years I've had problems coming up to a weekend when I thought to myself I can do nothing, and the frustration gets quite high at times. I can do nothing until Monday morning, or and if I knew that I could pick the phone up any time, because things happen at weekends almost as if by pure bloody mindedness sometimes. You can't even contact your own GP at the weekends. No, you get put through to whatever it is. Crises arrive at weekends, and you sort of try and live with it until the Monday morning again, and then you're phoning somebody, and everybody's phoning that person or those persons on Monday morning, so it's difficult to get through.
It seems to me to be rather foolish to have all the expensive equipment, the capital equipment there, the expense of training doctors, etc., in the art of thrombolysis, and then only utilising them for office hours. How do you justify that people who have a stroke at weekend probably are crippled or would die, and if they had it during the week, they could be fit? I can only now wonder what would have happened if I'd have had my stroke on Friday night or Saturday morning.
When the idea of providing a scanning service to the TIA clinic was first announced, some of the staff were a little bit apprehensive about the impact it might have. I think one of the important things is that during the meetings and the discussion about the setup of the service, all the meetings were inclusive rather than exclusive, so that everyone was aware of what was going on and no one felt excluded in the process and so had a voice. Before we started the TIA service, we worked only Monday to Friday. So it was a big change for us moving to covering the weekends. However, we discussed this with our management team. We also discussed this with staff side team as well. And we agreed the hours that we would work at weekends, and we also agreed that we would take a day back during the week in time in lieu. And I think the staff all realise the benefit of having a 7-day-a-week TIA service. We work very closely with our vascular consultants, and I think we realise the importance of patients having rapid access to carotid endarterectomy, and the fact that they could be at risk of suffering a further TIA or even a major stroke if their treatment is delayed. And because the carotid scan is such an important part of the if you like, the TIA assessment pathway, there was really no one had any objection, and everyone was happy to move to working to the 7-day-a-week service.
Working 7 days a week in the assisted conception unit was actually put forward by the scientific staff. The scientific staff were really keen to work over 7 days to actually benefit the patients and for better outcomes. It was quite clear to them that by working over 7 days they would be able to extend culture of embryos to day 5 and therefore select embryos with the most potential to implant and produce a live baby.
Having a 7-day-a-week service improves patient safety. For instance, if a patient has a TIA on a Friday evening, if there's no 7-day-a-week service, they would have to wait for a Monday morning to come in for their scan. And if they have a significant stenosis, that means they've waited 2 extra days. There's a delay in commencing their treatment. It means that theatre slots may not be available till possibly later in the week or even the following week. So again, it delays treatment and surgery. And that might impact on the patient in terms of, we know their patients are at higher risk of having a stroke following a TIA, and any delay could increase the risk of them having a major stroke.
It's recognised that one of the key risks for mothers and babies are multiple births, and obviously with assisted conception and IVF, when we're putting multiple embryos back, there's a real issue there. So there's been a national strategy to reduce the number of multiple pregnancies and multiple births, and this is via the One at a Time programme. One of the key ways of doing this was to grow our embryos to day 5, which involved 7-day working. 7-day working has had a massive impact on the success rates for assisted conception. So what we're able to do is actually mimic more closely what happens in vivo. So rather than actually putting embryos back on day 2 or day 3, which would limit us to Monday to Friday, we're actually able to extend culture of embryos to day 5. And this allows embryos to grow to the blastocyst stage, which is more in keeping with the stage embryos would be in vivo when they actually reach the uterus. So implantation should be better at that stage. One of the other advantages of 7-day working for the patients is that we can actually take them through natural cycles, particularly for frozen embryo transfers. And some of the patients will prefer this rather than using stimulated cycles with drugs. So it makes it a more natural process for them. It also means that we can go ahead any day of the week and their cycles are not cancelled, whereas if we were only working Monday to Friday, we may have to cancel cycles.
The feedback from patients has generally been fantastic. They like the idea of being able to have all their tests in one session. They're told beforehand they may have to wait 2 or 3 hours for all the tests to be completed, so they're prepared. But at the end of the diagnostics, they can see the consultant, they can be told the results of all the tests, and they can be told about management and further treatment. And I personally haven't had anyone complain or say anything negative about the service that's being provided to them.
For assisted conception, it's not an emergency service, it is an elective service. So patients have a choice of where they can have their treatment, and in order to be a provider of choice, we need to be able to provide the service that the patients want when they want it. One of the advantages that the patients have voiced to us is the fact that by coming into the clinic at the weekend, they feel far more relaxed. They're not rushing to get off to work or whatever other appointment they might have. And in fact, the staff themselves have also said the very same thing, that they feel far more relaxed at the weekend. And we do anecdotally seem to have better outcomes from patients who actually attend for treatment at the weekend. The staff feel they have more time to spend on a one-to-one level with the patients.
People ask if all services should be 7-day a week. I don't know about that, but I know personally working in the TIA clinic, I'd feel unhappy knowing that people didn't have access over the weekend and the consequences it might have for them. So my motto would be to get on and do it really, and resolve the problems and discuss with your colleagues how to implement this service.
So the question is, do you believe that the high quality service that you're providing is meeting the needs of the patients and carers who use it 7 days a week?